Our group is going to be evaluating the association between weather patterns and human West Nile virus infection in the United States. First, let's give a little introduction to the West Nile virus. The West Nile virus is a mosquito-borne virus first identified in Uganda in 1937. It was first detected in the United States in 1999 and remains the leading cause of mosquito-borne illness in the U.S. The largest county level outbreak in the U.S. occurred in 2021 in Arizona, where there were 1,487 disease cases and 101 deaths that were reported. This disease is transmitted by the Culex species mosquitoes and through avian hosts. It can move to other mammals, so humans, horses, and other mammals do contract West Nile virus, but they are dead-end hosts. It can rarely be transmitted through the virus can rarely be transmitted through blood transfusion, organ transplantation, perinatally, conjunctival exposure, and through breastfeeding. The West Nile virus is part of the flavivirus family and most commonly is spread to humans through the bite of an infected mosquito, as mentioned earlier. Most infections are asymptomatic, however, severe neurological illness can occur. Um, Approximately 80% of infected individuals have no symptoms, but about 20% develop a febrile illness. The severe neurological illness happens in about 1% of patients. And this disease is found in other areas globally, but for the purposes of this project, we're focusing on the United States. So, looking at the previous literature and research that's been done on this, there are 5 points that we want to mention that have been identified. So, the first point is that higher temperatures accelerate mosquito development and viral replication. Higher temperatures increase mosquito biting frequency, they shorten the mosquito development time, and reduce the extrinsic incubation period, which is the time that's required for the virus to become transmissible within the mosquito. Heavy rainfall is the second point. Our second point is that heavy rainfall can increase mosquito breeding habitats. Precipitation was associated with increased mosquito abundance and subsequent West Nile virus transmission in the Chicago region in one article. Standing water created after rainfall also provides breeding sites for Culex mosquitoes, as well as other mosquitoes, for them to start to replicate during that time. Drought conditions may also increase transmission by concentrating birds and mosquitoes around limited water sources. So if you think about having, you know, limited supply, there is going to be a popular grouping of birds and mosquitoes around those shrinking water sources. Increased West Nile virus activity has also been seen in following drought conditions in parts of the United States. Continuing on, the weather influences mosquito abundance and seasonal timing of outbreaks. So we do see that temperature and precipitation influence seasonal mosquito abundance and affects the timing of West Nile outbreaks. Decades of surveillance have shown that warmer seasons are associated with increased human cases, which makes sense since that's when the mosquitoes are replicating. And then previous studies suggest that environmental conditions can help predict West Nile virus activity. So looking at meteorological variables can improve prediction for West Nile virus cases and potential epidemics. We're looking to incorporate weather into the surveillance system, which may strengthen public health and early warning systems. And then predictive models using weather and environmental variables can be used to forecast West Nile virus, hopefully to prevent any epidemics. Why is this important? So, public health importance is that the West Nile virus remains the leading mosquito-borne illness in the United States, as mentioned. We do see about 100 to 130 deaths on average in the United States. Weather patterns are becoming more variable due to climate change. So, because of the driving up of the global temperatures, we see um, the water cycle slowing down the jet stream and then leading to longer droughts, stronger storms, and more extreme temperature swings. Identifying weather conditions that are associated with increases in disease might improve mosquito surveillance, public health preparedness and forecasting efforts, early warning systems if we know that there's a certain area that may experience an outbreak, and community prevention efforts. So this also may assist, even though it's not the primary goal, it might assist in efforts to decrease transmission of other mosquito-borne illnesses that are spread by different species as well. The purpose and specific aims of this, the research purpose is to investigate whether weather conditions are associated with the incidence of laboratory-confirmed West Nile virus infection in humans. The question is, how do temperature and rainfall influence the occurrence of West Nile virus infections in our study population? And then the specific aims would be to evaluate whether weather variables can improve prediction of seasonal um, West Nile virus cases, mainly looking at the factors of temperature and precipitation, and determine the association between average temperature and human West Nile incidence, and then assess whether rainfall is associated with increased West Nile virus cases.
Yeah, so our reference population is basically the group for whom our findings will apply, and it's also the population that we'll sample from. In our case, we define it as the uh, as basically anyone living in the 48 contiguous United States who live in areas with established Culex mosquito vector populations and also are surveilled by the ArboNet system, which is run by the CDC. The West Nile virus transmission season runs from June through October, so that's when most of the data is collected. We define it nationally because the scope of our project is national, and it's also, and like we mentioned earlier, it's the most common domestically acquired mosquito-borne illness in the continental United States. And because weather, which is our exposure of interest, varies, weather and precipitation, both of which are our exposures of interest, vary wildly across the country. This gives us a broad range to work with. The population also includes both sexes, all ages, all race and ethnicities, as well as all socioeconomic groups. Essentially, it's anyone who can be bit by a potentially infected mosquito. So practically, this means that the results are meant to generalize across the 330-ish million people in the US, minus those living in Alaska and Hawaii because they lack an established WNV transmission. In terms of the study methods and the sampling methods we're using, so we will be using, since this is a case control study, we will be sampling on the basis of disease status. For our cases, we'll be using all laboratory confirmed human disease cases that are reported to ArboNet during the study period using the standard CDC definition and confirmed by like PCR or other laboratory based exams. We'll source these cases through participating state and local health departments, and we'll count them based on symptom onset date. We will include both neuroinvasive and non-neuroinvasive cases to improve statistical power and generalizability. In terms of our controls, we'll just be using people without West Nile virus who are drawn from the same reference population that I defined earlier, using like basically address-based or random digit dial sampling of the general community. The controls will be frequency matched on age group, sex, and enrollment month, and then we're not matching on residential location or on the weather variables because our weather is our exposure of interest, and matching it on geography would remove the variation that we want to study. We also enroll 2 controls per case to improve precision. In terms of our sample size, we're hoping for about 900 cases and therefore roughly about 1,800 controls, so about 2,700 subjects total, pooled across 3 WNV transmission seasons. That gives approximately 80% statistical power at a 2-sided alpha of 0.05 to detect an odds ratio on the order of 1.3 for a moderate rise in temperature or heavy rainfall exposure. Which is a magnitude that's consistent with other prior weather-related West Nile virus studies. In terms of our overall study design, it's a retrospective frequency matched case control study. This was chosen because WNV is relatively rare. The outcome is captured by existing surveillance infrastructure, and the design like very effectively lets us look back in time to see both the weather and see how that weather preceded the illness. This was based on prior literature. So how are we collecting the data? In terms of our exposure, which is weather, for every subject, we geocode their residential zip code and link it to a like a gridded daily meteorological data from the NOAA and PRISM for the 2 to 4 week window before the symptoms start, or a matched reference date in the case of the controls. This window reflects the mosquito, uh, basically reflects how mosquitoes can amplify due to weather, as well as the lag time caused by human incubation, um, as seen in the literature. In terms of outcome, laboratory uh, will be using a laboratory confirmed WNV status obtained from ArboNet / Health Department records. In terms of covariates, we will give subjects a brief questionnaire which captures their age, their sex, socioeconomic status, how often they're outdoors, do they use mosquito repellent, and do they use mosquito protective clothing, like long sleeves, as well as relevant comorbidities, sorry, to adjust for confounding and individual level risk. In terms of our timetable, so like months 1 through 3, we'll finalize our protocol, obtain IRB approval. Month 4 through 6, we'll be recruiting from participating sites and building our weather linkage pipeline. Month 7 through 30 will be enrolling cases and controls across three transmission seasons. And then the subsequent months will be data processing, data cleaning, and then doing data analysis.
Okay,
Yeah.
now we're going to go into our study exposures. So the factors that we will be studying are changes in weather pattern, which include changes to temperature and precipitation, which have been stated to affect the mosquito population in the United States and have led to trends of West Nile virus outbreaks, according to a study done by Singh et al. In this proposed study, when it comes to considering a possible instance of exposure to temperature, temperatures will have to have reached higher than normal annual temperatures, as well as had experienced higher than normal temperatures prior to a West Nile virus season in the area where the participant who contracted West Nile virus lives. According to a study done by Han et al., the the study concluded that higher than average annual temperatures led to counties within the United States to experience higher than normal instances of West Nile virus. The Han et al. Study also found that higher than average winter temperatures led to more instances of West Nile virus cases, especially during the West Nile virus season. Another factor that has been shown to affect instances of West Nile virus is precipitation. In a study done by Han et al., it was concluded that in some areas of the United States, particularly in the Northeast, Southeast, Ohio Valley, Upper Midwest, Northern Rockies and Plains had higher than average instances of West Nile virus due to lower than average precipitation. The other climate areas that were investigated in this study also experienced higher than average incidences of West Nile virus, and particularly the western regions of the United States, due to increased precipitation. In this study, an exposure to precipitation will depend on the area and the climate that participants live in, as well as the annual precipitation. If an individual contracted West Nile virus and had experienced higher than average precipitation in the area they live, it will be considered an exposure if the area that participants live in have a pattern of increased precipitation and increased West Nile virus cases. So onto the study outcomes. The West Nile virus is a virus contracted from mosquitoes and is considered a neurotropic virus. This virus can affect neural cells of individuals that contract the disease after coming in contact with a mosquito that has the virus. Not only does it infect the neural cells, but it can severely affect the central nervous system, which induces neuroinflammation and neural death, contributing to several clinical manifestations such as meningitis, encephalitis, and acute flaccid paralysis. According to Singh et al., individuals who contracted West Nile virus are often asymptomatic, but approximately 1 in 150 cases progress to a neuroinvasive disease, potentially leading to encephalitis or death states weighing at all. Due to most individuals not having severe complications due to the West Nile virus, this proposed study will be investigating any outcome where individuals contract the West Nile virus, even if they are asymptomatic or only have a mild case of West Nile virus. In this study, how the outcome that we are testing will be defined is that an individual who contracted the virus will have had a previous diagnosis of West Nile virus where laboratory diagnostic testing was completed to indicate that the individual had had the virus. According to the CDC, to indicate the presence of West Nile virus, IgM antibodies specific to the West Nile virus have to be present in the serum or cerebral spinal fluid, even though antibodies may be found. It could also be caused by other flavial viruses. To make sure that we are studying an outcome of West Nile virus, the cases of West Nile virus will have had to be confirmed by plaque reduction neutralization tests. According to the CDC, the tests are able to determine the type of infecting flavivirus. Um, and so on to participant privacy and safety. To protect participants' privacy through this study, information that the participants provide will be unidentifiable and have special codes given to them, but will not be able to be traced back to the individual participant. Other safeguards that would be included to ensure participants' privacy would be to provide training to any researcher involved in the study to make sure they are aware on how to handle sensitive information, as well as how to properly store information. To make sure that participant safety is ensured, consent forms will be given to the participants, informing them of the nature of the study at the time they are recruited for the study. The form will also include information about how they can rescind their consent anytime during the study if they no longer would want to participate. Not only will the form include information about what the study is about, it will provide a warning that personal information might be collected during the time of the study. The form will also inform participants to make sure they are aware that their information will be used for data analysis, but will become unidentifiable. A follow-up will also be conducted to ensure that participants want their information to be a part of the study. To ensure the quality of the data throughout the study, informations like a diagnosis of West Nile virus will have to be corroborated by health records that the participant is willing to consent to providing to ensure they were properly diagnosed with the West Nile virus. Also, any extreme outliers will not be included in the study and will not be included in data analysis to make sure that the data accurately measures the association between the exposure and the outcome. And then on to our data analysis and how it will be conducted. To analyze the data in this proposed study, techniques and measurements that will be used will include measurements like the odds ratio. The odds ratio will allow for an association between exposure and outcome to be drawn by indicating if the case group is more likely than the control group to have been exposed to different weather conditions. Another analytic tool that might be used is calculating z-scores of the precipitation and temperatures in each area that is represented in the study, and how many standard deviations they are away or below the mean. In the study done by Han et al., this method was used to determine if weather patterns were changing to draw an association between West Nile virus incidences and changes in weather. In this study in particular, it will help determine if precipitation in an area where there were cases of West Nile virus were exposed, as certain areas only experienced increases in West Nile virus cases if they were lower than average annual precipitation, while some had to have experienced higher than average annual precipitation.
Uh, this study still have some limitation. West Nile virus cases may be underreported because many infections are mild or symptomatic. Weather exposure is based on zip code. so it may not show each person's true exposures. Also, this study can show associations, but it can not prove causation. Future research could add mosquito and bird surveillance data. It could also compare different US regions because weather and mosquito patterns varied by location. This finding may help create early warning system for local public health department. They would need West Nile virus case data, weather data, short questionnaire, security secure data store, statistic software, GIS software, and training people. Overall, this study could help improve West Nile virus surveillance, mosquito control planning, and public health preparedness.
And then these are our references. Thank you.